Anasha Neely. While we're waiting, would you like to welcome the
Okay, are we good? Are we ready for me to
we
start?
we are ready.
Okay, I apologize. Don't know what happened. I disappeared, but doesn't matter. I'm back now. Welcome, everyone. I'm really excited about this event. This is the first time, if I'm not mistaken, that SBAC has done a workshop dealing with infertility, at least a virtual workshop dealing with infertility. In case you care who I am, let me tell you, my name is Dr. Tachi, or Chatachi Egwu. I am a media professor, filmmaker, media content producer, also a journalist. I am also the co-founder of Indie Soup Media, a media content and full production hub, and I'm with SBAC as well. So I'm glad to be here to talk about this with these wonderful distinguished guests and my sorors, and also distinguished guests, those of you that are out there joining this webinar. Thank you. Thank you for registering. Thank you for coming, because it's because of you that we're even able to do this. So thank you, and thank you. So I think what we should do is actually start by, we have our welcome, if I am not mistaken. Do we have our second vice president? Yes, we do. Hello.
Hi, Tachi. Good afternoon or good evening,
Good
everyone.
afternoon.
Good evening, everyone. Thank you so much for joining us. My name is Anasha Neely. I serve as the second vice president of the South Broward Alumni Chapter and the program and planning chair. I am here on behalf of our president, Dr. Shawanda Richardson, just to welcome you to this informational webinar and conversation on infertility, a physical and mental health conversation. We welcome you. We thank you for joining us this evening, and we hope you leave with some information that you can take forward with you and it will benefit you in many ways. Thank you again for joining us. Have a great evening.
Thank you, Sora Neely. It was great to have you fill in for Madam President. Thank you so much. All right, well, let's get to it, because we have a lot of time, but we don't have much time. And this is a very important subject that is not talked about. We like to be hush hush about a lot of things. And because we're hush hush, we tend not to learn or get the information that we need. And I see a lot of familiar faces here, and welcome to all of you. So if we could, I would like to go around and do some information, introductions that way before we get into it. Could we start with Dr. Anderson, please?
Yes, hello, good evening, everyone. I'm Dr. Tadra Anderson, and I am the Chief Medical Officer at Memorial Hospital Miramar. I'm really pleased to be joining you all this evening. I'm also a fellow of the American College of OBGYN and a board certified obstetrician gynecologist. And as you have said, Tachi, this is quite a crucial conversation that we're going to be having, especially in our community where we tend not to talk about certain things, especially things that happen in and around the bedroom too much, or things that do affect our mental health. So I'm particularly pleased to be here tonight representing Memorial Healthcare System in this wonderful conversation with you ladies and your guests tonight.
Fantastic. Thank you so much for being here and for that wonderful introduction. And we have next, I want to say your name properly, Ulrich J. Oxime. Did I say it right?
Close enough.
No, there's no such thing as close enough. We're going to have you say it properly for the audience and why you're here.
All right, cool. It's Ulrich J. Oxime. I am a licensed clinical social worker located in South Florida. I work with adult men experiencing anxiety and depression. And I believe I'm on as a male guest who suffers with male infertility. So I'm on both sides. So that's my story.
Wow. Thank you so much. It's not often talked about from the male perspective, and we're going to get into that today, how it affects males, etc. So thank you so much. We're going to go to Dr. McDermott. Please introduce yourself.
Hi, good evening. Thank you for having me. Thank you to the South Broward Alumni Chapter of Delta Sigma Theta for bringing me on this evening. I'm excited about sharing with peers and colleagues in the field. I am Dr. Demerit. I am owner and clinical director of Wonderful Counselor, LLC. It is a private mental health practice where I provide clinical services, therapeutic services, predominantly to women of color and many who have struggled or have challenges with infertility. So I'm excited to be here, and I look forward to sharing and participating with my colleagues here today.
And let me apologize because I clearly intended to say Demerit, and why I said McDermott was I thinking about Dylan McDermott. I was like, what's going on?
It happens all the time. People put that M there, and I'm like, I don't know. I don't know what happened, but yeah, it's all right. Dr. Demerit, that's
Dr. Demerit, not McDermott, Demerit. Okay. And we will go next to someone I know quite well, Nay Sims from Black Girl IVF. Go ahead and introduce yourself properly.
Hello, everyone. My name is Nay Sims. I am a founder of Black Girl IVF, and I am here today as a Black woman who has suffered from infertility and chose IVF as a mode of having children. I'm also a wonderful and proud member of Delta Sigma Theta Sorority Incorporated and a former member of South Broward Alumni Chapter. So I'm super happy to be here and talk to you about my experience from that particular space.
And we are super happy to have you here. It's good to see you again. Thank you for participating in this event. Let's hop on over to Miss Neely. Are you also speaking? I wasn't sure if we should have you introduced again. If not, we will keep going and we will go to Sandra Elidor. Please introduce yourself.
Hello, everyone. I hope everyone's doing great this evening. My name is Sandra Elidor. I am the founder of Filling Empty Wounds, where we believe that we all have space in this infertility world, regardless of where you are in this journey. I started this organization because of my story of infertility and miscarriage and the ups and downs that cause us mentally as well as physically. I didn't have a table when I was going through the infertility process. I didn't know who to connect with, friends and family. And this was a conversation that others were having. So I decided to, you know what, let me create this nonprofit. And our goal is to be able to help fund infertility because we don't have the fund. And where our industry is lacked in a lot of resources especially for minorities. So we're here to provide that gap that is missing in this space, but we also provide support as well.
Thank you so much. And it's great to know that there is support out there for those that are dealing with this. And I think we have all of our panelists. Once again, there are a few housekeeping things before we get going. Once again, we'd like to thank all of our guests. Thank you to the panelists for coming here and showing up and being open. Thank you to those of you that registered and our guests. We love a good registration. So thank you for registering and coming to this event. We certainly appreciate you. Let me say thank you to Physical and Mental Health, who are at the helm of this. Soror Sharice Gauze is the chair of Physical and Mental Health. So thank you so much for putting this together, putting this very important thing together. There are a few pieces of relevant data that I wanted to put out there before we got into our conversation. And we have about an hour and 15 minutes today to get into this. So we're going to get into it. We are going to delve, folks. And also, if there are questions that you have, please make sure, I think the way we're doing this is putting them in the chat. Someone can correct me if I am wrong. And that way we can get your questions answered by some of the many folks that we have here today. So just some basic facts. Infertility is a disease of the male or female reproductive system defined by the failure to achieve pregnancy after 12 months or more of regular unprotected sexual intercourse. And according to a recent published report from the World Health Organization, or WHO, large numbers of people are affected by infertility in their lifetime. Around 17.5% of the adult population, which is roughly 1 in 6 worldwide, experience infertility, showing the urgent need to increase access to affordable, high-quality fertility for those in need. Now, we can go in any order. I'm not necessarily going to call on anyone, but if you think you have something to add to any of the queries, please do. My first question is this. It feels like through what we see, through what we hear, even though it's not really talked about, the things that we do see, for example, on social media, that we do see in media is Black women, not often Black men being talked about, but Black women being affected by infertility. Does this, and maternal health issues, this has been in the news a lot because of the fact of Serena, tennis player, help you know what I'm talking about, being in the news because of problems during delivery, etc. So Black women's maternal health is front and center now, but is infertility as big of a problem as it's being purported in media? Anybody can answer this.
I'll jump right in. Thank you
Go
for
ahead.
the question. I do think absolutely it's a huge challenge, many barriers to overcome, very similar to what we are witnessing and know to be true in the Black maternal health space. Infertility is really a subset of that for a host of reasons. Some of that has to do with the social determinants of health in terms of access. A lot of that also has to do with the fact that there are actually studies that show that as Black and brown women, we are offered some of the services a lot later than our white counterparts. And I see a lot of my colleagues on the panel who are nodding, and that's unfortunate, especially still here in 2023. It's why these types of panels and webinars that you're having today, so kudos to you, the South Broward Alumni Chapter of Delta Sigma Theta, for hosting this so that our consumers and people who look like us know that they should push the envelope and not take some of the answers that we get or get pushed aside to say, keep waiting, keep waiting, keep waiting. And in fact, one of the statistics that you gave in terms of infertility, in terms of it being after a year, if you're already 35 or older or have significant medical problems, that number is actually 6 months. So I've had patients who've said, well, they told me I had to wait a year, but they're already 36 or 37 or 38. So really it's about getting that information out and having advocates. So I would say, in my opinion, it is a huge issue, just as we have seen with other Black maternal health issues.
Fantastic. And before somebody else jumps on that, if you wish to, let me ask you, Dr. Anderson, so age then is a determinant of infertility. It feels like
absolutely.
Yes, yes, yes. And the reason I'm asking this is because the narrative, even historically, is that Black women are baby making machines when it goes back to being enslaved, etc. So that narrative is that this is not a problem, but we're hearing today that that is not the case.
Absolutely. Age absolutely impacts infertility. What we should all recognize is that we're all born with a finite set of eggs, and those eggs actually from the time that you're born start to decrease, and some of them actually start to malfunction. So the peak fertility age is really in the late teens to the late 20s. By the time that we're 30, we see that fertility rates actually do start to decline, and much faster after 35. So we, as part of the Industrial Revolution, right, we're working women, we've been in the workforce, things like that. Some of us have decided to delay having children or trying to have children, we've been told that it's okay to wait, when in fact, we need to have these conversations with our doctors, because the rates of pregnancy, which is actually considered a fecundity rate, is about 25% month over month for those who are actually trying, but that's when you're in your 20s and early part of your 30s. Once you start to hit those later part of the 30s, that number decreases, and by the time you're 40, it's less than 10%. And those are numbers that, for whatever reason, there's a whole you can have a whole nother seminar on that. But for those who are not culturally competent, they don't share that information readily with people who look like us.
Mm, mm. And does anyone else want to add to that? Go ahead, Nay.
So going back on what Dr. Anderson was saying, right? As a person who I met my husband when I was 30. So between 31, because I turned 31, and 40, I had 11 miscarriages. And what led me to my IVF doctor, and this is where advocacy comes into play with the doctor that you choose to have, right? Because around miscarriage number, this was all an accident. I was in Florida, no family, no nothing. It started with an ectopic pregnancy. And I ended up at Memorial West with a doctor there. And that's how I found my OB. And I had an amazing nurse practitioner at the time. After miscarriage number 4 or 5, she was the one who says to me, you know what, we need to find out what's going on with you. And even as a Black woman, she was Black, and she was a white nurse practitioner, and there was a Black nurse practitioner in the office. And she says to me, I want you to go see this particular IVF doctor so that when you get pregnant, she can start to see you, right? And then she tested everything for me. She went through everything, but this is where you have to have a doctor that advocates for you, a doctor that sees you as not, oh, Black people should have babies, or Black women are, this is what they should be able to do, so there's no problem. I didn't even think to make that transition, but because she did, she put me in that place, I was able to find out what was going on with me. But again, this is starting at 31, and I didn't have my first child until I was 40. Excuse me. And so through that, it was, unfortunately enough for me, I did have a lot of eggs left, but at the end of the day, it was a lot of stuff going on for me in my 30s that led to me having to choose to, get rid of both of my fallopian tubes and then just do IVF. So, but again, having someone that advocates for you, that sees you, not just as, oh, it'll get better or whatever, really plays a part. And then again, that age, because and Dr. Anderson can attest to this, even when I got pregnant, I was still considered a geriatric pregnancy, right? So there comes that, right? Because not only if you do manage to get pregnant after 35, you then are considered a high risk pregnancy, that something can possibly go wrong. And again, testing the embryos, making sure that they're viable, all of those things play a part if you have the money, if you have the insurance and all of the things to make sure that not only will you get pregnant, but your children will not have a whole lot of issues. So again, that advocacy from your doctor also plays a part in seeing you as a woman of color.
Absolutely. Absolutely. Go ahead, Sandra, go ahead.
Oh, just wanted to add a little bit of what you ladies are saying. A lot of you mentioned now the statistic is 1 out of 6. It used to be 1 out of 7. So that's how much the numbers are growing. And honestly, I think the number is even more because us African Americans, we don't speak, we don't talk. By the time we see a fertility doctor, years has gone by, and by then we are trying to be proactive versus reactive. So by that time, I don't believe the 1 in 6 is even valid if you really count how much time that lasts between African Americans and when we actually bold enough, I would say, to actually see a fertility doctor. Just like any doctor, I don't know why we have an issue to see it. If you have cancer, you're going to go see your doctor. If you break your arm, you're going to see, but for some reason, it takes a lot for us to go see that as if we're broken. In reality, we're not broken. And I think a lot of it has to do, we also don't discuss those precursors, those issues that cause infertility to begin with, the PCOS, the fibroids, the endometriosis. We're not addressing those issues because we're so used to them telling us, oh, our pain is not the same level as everyone else. So not only we need to educate, from the support from medical professionals, we have to be able to talk amongst ourselves because our counterparts are having these conversations. So they're getting the resources right away. They're understanding that, oh, so-and-so saw this doctor. This is not right. And we need to be able to have those conversations. We're no longer in the age that saying is taboo is okay, because that means we're lacking resources. We're lacking research. We're lacking so many things that can benefit us, but because of that fear of things should be left at home, we're not getting that information that we need that could remove so many years, so many sufferings, so much of that mental instability of infertility when we can just talk, just open up, just even for a little bit, just allow yourself to breathe a little bit and own it. This is what's going on. I don't know what to do, and be okay with that.
Thank you. Thank you for that. Ulrich, I want to get to you in just a moment, but let's go to Dr. Demerit.
Yeah. Yes, Sandra. So when you were speaking about we're not speaking up, it's so interesting. I'm just going to pivot just a little bit and we can pivot right back in the mental health space, right? We know that women, 40% of women who have challenges with infertility are also suffering from depression and or anxiety, right? But then when it comes to the men involved, right, the number is lower because of underreporting, right? We don't have the data that really shows that men are suffering just as much as their counterparts who are dealing, who has to deal with the infertility. So underreporting is a huge issue. And I mean, I know that if we all came and talked about things and shared what was going on, the numbers would tell a really, really, really different story of what's really going on in our communities.
And that's an important thing to put out there, that the underreporting is a big factor in all of this as well. So it's not that it's not happening, it's just not being reported. Thank you for that. So we talked a little bit about the whole thing. There's a stigma attached to it. So Ulrich, I can imagine there's an even bigger stigma when it comes to infertility and men. Can you talk to us about your experience?
Oh man. So when I realized we were having difficulty conceiving, I took a look in the mirror and said, you know what, I might be equally responsible for that. Because in the work that I do, the colleagues and stuff like that, the stories that I hear, sometimes it's the male partner that's refusing to do simple things as getting tested just to make sure it's not on their end. So I approached my wife with it and said, you know what, I'm going to take a look. And if you do want to take a look as well, you definitely have the right to do so. I think it's a great idea if you do so, but I'm going to check out things on my end. I believe my wife was a little skeptical at first that it would be even on my end or anything like that. I think she was a little bit afraid to see or maybe learn that it's on her part potentially and what that would mean. So went to my primary care doctor and she was brushing that off too. Like, oh, you only been trying for this long, diet, exercise. Yeah, you're a little overweight. I had that COVID weight on me. So let's drop that and do all these other things. And I'm like, I don't know. In the back of my mind, I'm like, something may not be right here. So finally we get to the year mark, the magic number, and still nothing. So she refers me to a urologist. He sends me over for some tests and everything like that. And my boys are not doing well. And it's like, wow, if I would have known about this when I had that gut feeling and everything like that and expedite the process, then I would have been further along. So to answer your question about the taboo and the stigma and everything like that, I didn't say anything to friends or family up until recently about the whole situation. And it was more so sort of like a stopgap sort of situation because you've been married for a certain amount of time and everyone's looking, oh, you'll be a great father, you guys will be great moms, look at this house that you all bought and this and that, and whatever. And it's just like, hey, all right, this is what the situation that we're experiencing and going through. And I have some friends that are a bit younger and not in a situation where they're married yet, or they have that forever partner that they see themselves having children. And I said, hey, maybe, I don't know, maybe finagle a couple of things and get yourself checked and make sure that your whole situation's good. Because not that, I have friends that are drinking and doing other things, but other lifestyle things that might be affecting their whole situation. I'm like dancing around and I'm with doctors and everything like that. And I'm acting like I'm in elementary school, my wordage, but making sure, your guys are good and your health is overall in a good place. And it really made them think. So I'm glad in a way that I'm going through this situation so I can be an advocate for at least the male counterparts in all of this and starting to normalize this and it not be something that affects a person's sense of masculinity or what it means to be a man. I think I handle all of that stuff okay, and it just, a part of in our industry in mental health to get better, we have to first understand what the problem is and admit that we have a problem. That's our first step. So once that's sort of taken care of and we step in our light and step in our truth, we can begin to work on what our options are at that point, and hopefully get to a place where we get to acceptance or get to a solution to whatever that situation might be.
And I think that the overwhelming narrative is that, number one, it's even still, it's your fault as a woman if there is something going on. And number two, there's this overwhelming pressure to have children. So by any means necessary, you do what needs to be done. And there's a lot of finger pointing sometimes that we see. So it's interesting that you're bringing forth your experience, and we thank you for that. And I see a hand, Dr. Tadra, go ahead.
Yes, thank you. And I just wanted to applaud Jay for being here because it is tough to discuss these issues, but I appreciate it because you're making an impact not only for men, but also for women who need to hear exactly what you just said. And I would share that, when we talk about the causes of fertility or the types of infertility, it's about a third when you look at male factor infertility, female factor infertility, a combination of the man and the woman together. So you really are in this together. And then the last 10% being what we call unexplained or unknown. There's just no reasonable cause. So when you look at it, we're all in this together. And I think one of the things that we can do to help ourselves is to recognize that it's no one's fault. It's what is happening to us, like any other, thing that, as you said, once you know, then you can find out what are those causes and then try to get to the root of that. And let's be supportive in that. So I want us to understand, because it does affect us mentally. And when our mental health is affected, it definitely hurts and harms our physical health. And those two things, along with our emotional health, are tied together. You cannot separate the pieces of man or woman, as it were, in those spaces. And when we as African Americans and people of color learn to understand that, I think that we will do better. And I pray that we will, but I think that we absolutely will.
You're on mute.
You're on mute.
Thank you. And I didn't even see that. Thank you for letting me know I was on mute. Okay. So here we go. For those of you that are attending the event again, thank you very much. But there will be a post-event survey, and the link will be placed in the chat, I believe. So if possible, please make sure that attendants, please put the link to the survey in the chat for our attendees. And please make sure you take it, because that lets us know how we're doing with the programs, whether you enjoyed the program, and whether or not to do more of these types of programs, the important programs with topics like this. All right, so moving on, if you're just joining in, thank you for being here. Welcome into the fold. This is a program of SBAC, South Broward Alumni Chapter's Physical and Mental Health Committee. We are talking about infertility today, something that is not often talked about, but many people suffer from, and it is important, both men and women. So I do want to move the conversation along a little bit and ask some questions again. So here's the thing. If you already have a baby, if you had a baby once, can you be infertile a few years later?
Absolutely. Absolutely. And that's something to think about, because a lot of culturally incompetent or less sensitive physicians will say, oh, it's going to be fine, but it can. Number one, as we talked about earlier, because you've already aged. So depending on your age that you are when you're now trying to conceive, it also depends on if you have a different partner or not. And also, what type of delivery did you have before? So surgical deliveries such as cesarean sections can increase scar tissue. There could have been infections related to that or other things. So there could be other factors that then lead to an increased rate, age being the top of mind. And so you always have to think about that. But it's something that, unfortunately, I've heard people say to others, that they, you've had a baby already, you'll be fine. And that's not always the case. I think following up with your physician, again, a culturally competent physician, which is not about color, race, or ethnicity. It's about someone who sees you, as Nay was speaking about earlier, who recognize who you are as a person, your goals, and getting you to those goals in a manner that suits you and your needs and your desires in a healthy way, and following, standards. But following up with your physician and having those conversations. And really, we talk in terms of making a reproductive health plan. So if I had a child now and I want to wait, having that conversation in between with my physician and say, hey, I'd like to wait. What should I consider? What should my options be? And then reevaluating that plan year over year, so that when you are able or ready, or your lifestyle, you've changed and something happens and you're now ready, you can review that, so that if there's something that then prohibits you, you're further along that journey in terms of having some of those things in the top of your physician or your healthcare provider's mind.
Well, thank you for bringing that up. But what are the options? I think we talk about options, but what are they? Oh, Ms. Alador, go ahead.
All right. Yes, secondary infertility, it's called secondary infertility. So a lot of people assume, since they already had their child, that it's easy to get pregnant later on. And that's just not the case for many individuals. So I always say, even if you do have a child, be very calm and collective and understand your counterparts, because unfortunately, we hope that you never have to be in the shoes. It's a club that we're in, but we don't want to be here. We don't want to be here, but yet we're still here. But the options that I know I wish when I did my first cycle that I really want us to start talking about is egg freezing. It's freezing your eggs, and we do not have those conversations. And if you want to continue your education, that option is there for you. So when you're ready, you have viable eggs. So I think that's a conversation that we need to have more and more, is freezing the eggs. I heard a friend of mine that's a doctor in Texas. One of the individuals that have infertility are medical professionals. A lot of medical professionals have infertility issues, which was daunting to me, because you guys are in the field. So you would think access will be something, but it's not. It's definitely not accessible to African Americans. Yes, it's costly. However, even the option of mentioning it to others is almost non-existent. It's not mentioned enough to us as that's an option. Don't assume we just can't afford it, but it's still a conversation that needs to be had.
No, absolutely, absolutely. Go ahead.
I agree. If I may, I think when you think about options, you have to consider what is the root cause of the infertility, because they are varied. So there are options as varied as there are causes. But the first thing is your own self-help promotion. I would start there always. And I know Jay mentioned that earlier, but we do know that, people who exercise too much and are too thin, you don't think about that. But if you're underweight, you can have fertility issues as much as people who are overweight. You can have hormonal imbalances based on that, based on stress. You can have issues related to excess alcohol, drug use, even recreational medicinal drug use. So you medications that are prescribed for you. So I start with self-help promotion and making sure you have those conversations with your doctor. That should always be the first option after you've decided to do something further, and also making sure you're in the right mental space, because if you're not in a best mental space, it is a stressful process for most, not everyone, but for most, whether that's financial stress or emotional stress, etc. And it does take its toll on relationships. But before jumping straight to IVF, there are medications for men and women if there are hormonal issues. Sometimes it's as simple as a thyroid issue. People jump always to the fact that maybe it's something going on in the reproductive system, but your thyroid and areas of your brain actually control your reproductive organs. So those are some things. Acupuncture is another therapy that's a non-traditional medical therapy before you actually get to some of the assisted reproductive technologies that are specific to IVF, like intrauterine artificial insemination, the egg freezing, which we call oocyte preservation, and even more down the line. So I want us to think about those as options as well. The others being gestational carriers, which we used to call surrogates, and then adoption or doing nothing. And doing nothing is absolutely okay until you decide, if you ever decide that I want to do something. So for us, we really have to take ownership that if we don't have children, let's not shame our brothers and our sisters, because number one, some it's a conscious decision, and others it's a necessary decision to keep their own peace. And so we should support them in that.
Yes.
Fantastic. Let's go to Nay. Go ahead.
Actually, I'm gonna let Dr. Demerick.
Oh, did you? Okay.
Yeah.
I'm sorry. I started this whole McDermott stuff. I'm sorry.
No,
Dr.
it's
Demerick, go ahead.
That she wanted to say something for a little while, but I'm gonna add something after.
Yes, because Dr. Anderson
ahead.
dropping all of the gems, and I just wanted to make sure that we heard when she said you have to pay attention to all of it, right? We have to take a holistic approach when we're talking about the care of the person. We are a sum of all of our parts: spiritual, mental, emotional, physical, all of it works together. So when you start talking to your providers, if you go see a mental health professional, and that mental health professional don't ask you, when was the last time you see your PCP? When was the last time you had an OBGYN? When was the last time you did? If they're not asking those questions, that's a red flag for me. We have to be conscious about making sure we're providing integrated care. All of it makes a difference. So which came first, the chicken or the egg? So you came to see your doctor, you're concerned you're not getting pregnant. And then your doctor says, well, we might have some infertility issues. You get stressed. That stress impacts your body. Your body is now not in a good position. And so it creates the cycle. So it is very important that we tackle it on all fronts, making sure that you're whole. Just anecdotally, I have a client of mine. She had a pregnancy loss, and we have to make sure we're using the appropriate terms, right? Culturally competent means, how do you recognize your experience? Do you say miscarriage? Do you say pregnancy loss, right? We have to make sure that we're using the appropriate words, because words matter. And so this a client that I had, she experienced the pregnancy loss. She came to me, we did the trauma work, we put the work in, She cried the cries. She did the closure. She did everything that she needed to do. We talked about getting her another doctor to address her fertility because she was not connecting with the other one. Long story short, she is entering her third trimester of her current pregnancy, and she is doing well. We're taking it day by day, one step at a time. We're having her sessions monthly just to make sure she's doing well. So we have to take a holistic approach to all of these issues that we experience, particularly infertility.
Thank you so much for that holistic approach. And I that's with everything health wise. It's everything is connected. So that makes perfect sense. Thank you so much for that, Dr. Demerit. Yeah, I'm going to keep saying your name because I'm determined not to say McDermott again.
That works for me. You'll never forget it.
No, I won't. I won't. That means I need to take you to lunch, right? So I want to turn over to Nay. Nay, you had something to say, but I also, and you may be about to address this, but I wanted to know, you have been very transparent about your IVF journey on social media. And I'm wondering how important it was for you in terms of not getting past it, but dealing with it and helping others through it. How important was it for you to do that, to put this journey on? So, because most people, I shouldn't say most people, many people would not have, but you were very transparent. So I want to know a little bit more about that. But before that, go ahead with what you were going to say.
Actually, it ties all in, right? So
Okay,
going with Dr. Anderson, also Dr. Demerit, first things first, I was a person that actually had, like, if you take both of what they've said and put it together, you basically have me, right? So as I said before, I was a person who with all of my losses, with the exception of my very close family and my husband, I suffered. I don't want to say suffered in silence, but in a way I did, right? And the biggest piece that I think I missed was a support from somebody like Dr. Demerit. I didn't have a mental health specialist, so I really had to push through just with the support of my family and kind of like bury it deep, right? And what was happening to me was every single time that I would get pregnant, it was a cycle, right? And this is something that my nurse practitioner pointed out to me. First things first was anytime I got pregnant, I was going to the gym, I was eating right, and I was like losing a little bit of weight here and there. And one thing she said was, when you are when your body is working the way it's supposed to, those estrogen cells start to separate from the fat cells in your body, right? And your body starts to work properly. So I was getting pregnant. I didn't have the issue about getting pregnant. I had the issue about staying pregnant. So that was first, but then I kept having a loss. And after every loss, I would get sad and more sad. And then what was happening once I made it over to my IVF doctor was every time I would get pregnant, I already suffer from major anxiety, which even a lot of my friends and family didn't realize, just in general. I've been suffering from it since I was like 13 and still was able to hide that from a lot of people. But when I was getting pregnant, I was having major anxiety. And so what will happen is I get pregnant, I call my IVF doctor, they say, come in, let's check your HCG levels. And with that comes, you go every 48 hours. Do you understand how stressful it is to go every 48 hours for somebody to check your blood to tell you whether or not your pregnancy is viable? It was stressful. So I would get so anxious. And I'm like, oh my God. So then every time it would be after about 2 or 3 times, okay, it's not viable. So either I would go into a loss. I have had to have, I forget the name of the shot, but I've had to have the shot that actually caused me to have a loss. And then I've also had a situation where I went into a loss and the baby, whatever you want to call it, it didn't come out. So my body was contracting. So I had to go to the emergency and they had to open me up and they had to pull it out. Like all of these things, right, were just mounting up. And so I was just having so much, and I would just be, again, suffering inside. So then my IVF doctor, we made the decision to do what is called an HSG, I think is what it's called, and Dr. Anderson can correct me, where they kind of take some dye and they shoot it into your uterus to see, and mind you, I only had one fallopian tube because I had ectopic, so I lost one. So you shoot the dye in, they see how clogged the remaining tube, or if you have two, I only had one, tubes were, to see if it would still be viable for me to continue to get pregnant naturally. It wasn't until she said, it's not as blocked as I thought it would be, but I still think that this is the best course of action for you, that I said, you know what? Let's just take the fallopian tubes out, right? So she cut them out, and I kid you not, it was like it took everything away, because now I'm in a space where I'm like, I won't, because what was giving me major anxiety was the possibility of having another ectopic pregnancy. And with the ectopic pregnancy comes, what if I don't catch it in enough time? And if you don't know much about an ectopic pregnancy, if you have one and you don't catch it in enough time, it can kill you. So with that possibility, that was giving me so much anxiety. Once she cut it away, it was like my whole life changed. And so then we go through the whole process. But one thing, let me back up. Another thing, going back to what Dr. Anderson said about the holistic approach, when she checked me, she did I'm talking about 30 blood panels on me to try to figure out what was the root cause of my losses. And one thing I found out is that I have a blood clotting disorder called factor V. Like, my blood clots more than the average person. So when I was getting pregnant on my own, a lot of things could have been happening. It could have been, because a baby to your body is technically foreign. So when you have foreign things in your body fights it off. So my body was fighting off the pregnancy. And so once we figured that out, I was already taking what is called Lovenox. It's a blood thinner to try to help my body not fight it off, right? So then cut off the fallopian tubes, we do all of the things. And another thing that I did once I decided to do IVF was acupuncture. I found, but it wasn't just regular acupuncture. I found oddly enough, online, I found a woman acupuncturist who specialized in fertility. And we did acupuncture to really help my body go through this, transform it. I started eating right, like I did all of these things. I went to the gym the morning of my transfer with my daughter, went to the gym that morning, went to acupuncture afterwards, walked into my doctor's office. Not only did I know that I was pregnant, my doctor even knew that day that I was pregnant. Like, it was just something about that particular space that I was in that gave me the opportunity to kind of relax. So I say all of that to say, I chose to, once I had my daughter and she turned 1, I made it my choice to speak upon it for a couple reasons. One, Black people do not talk about it. Black people always say, pray about it, girl, it'll get better. No, Black people don't realize that IVF is okay. It's okay if you go through this process. And I wanted other women, other men that look like me and my husband to know we do this too. And although my insurance did help me cover the cost, we didn't know that in the beginning. As fate may have it, we got blessed. And I mean, this is sad, but it was good. Somebody had broken into our house and we had renter's insurance. They stole a lot of stuff. So we got a check, right? It was just like happenstance. And we took that money and we said, this is what we're going to do with it, right? We go in, we find out my insurance covers majority of it. And it just ended up being like, okay, we're in a good space. It was like, it was meant to happen. So I wanted women and men to know you don't have to be ashamed of the choice you make to have children, because really it's just it's between you and your spouse, really, and God, if that's what you want to do. But at the end of the day, I wanted Black women to know we can do this. It is costly, but there's other ways. Like, I just happen to be lucky about my insurance, but there's a whole medical office in New York that helps with, excuse me, helps people go through IVF at an affordable price. There's options. And you don't have to say, oh, if you don't get pregnant naturally, then it wasn't meant for you to have children. Says who? At the end of the day, God created doctors who got the knowledge to make it happen. That's what it is. And you don't have to be afraid to be in that space. You don't have to share it. But for me, I wanted Black women to know, not only is it for you, you can figure it out, but above all else, if you don't have anything else, you have me that can, one, say it worked, and two, I'm here to listen, I'm here to cry with you, I'm here to make you work through it. I am here.
It's okay.
It's good. Praise God. Share. Yes.
We with you. We are with you.
To be a positive person, an example that it can work. It's hard, and it may not work. I was lucky. But when my IVF doctor said to me, she looked me dead in my eyes and said, at 39 years old, I had 4 embryos. And just to give you an example, I had 40 eggs that she took from me. She fertilized all 40. 5 made it to biopsy and freezing, and 4 came back good. At 39, she said she does never have to have a conversation with a 39-year-old to say, how many do you want to transfer back? Because that's not normal for a 39-year-old. And the fact that both times, my son and my daughter, it worked both times.
Praise God.
To me, it's like, how dare I not share that?
Mm.
It was not supposed to cry. How dare I not share that with other people who look like me, to say, you can do this, and not be afraid to speak out, and not be afraid to say, it didn't work for me, or I need somebody to listen to me, or I need somebody to support, or just know that somebody looks like me and they went through this. And I mean, I'm shedding tears, not because, it didn't work, but because God is so great. And I went through so much. And to know that I have my 2 amazing rainbow babies at the end of this journey, and I'm not having any more kids, but to know that it was an option and we were able to get through it, I thought it would be more than selfish of me to not give it a platform. And not only that, and then I'm gonna finish. When I went through social media and I typed in IVF, all of the different ways, Facebook, Instagram, TikTok, when I tell you, there was no one that looked like me. All of the people that I found that talked about it on social media were white. They were white women, married, who went through this. And I'm like, how is there not somewhere somebody else that looks like me that is sharing their story? And so when I noticed that and how much I had gone through, I thought it was necessary for me to
Thank-
be the voice of the
Mhm.
voiceless. Because
Thank
at the
you.
end of the day, nothing is impossible and it's not out of reach. This is not something, I'm not special. I just had somebody that supported me, a white nurse at that, who supported me and saw me and thought that it was important that I go beyond my OB's office to really examine what was going on for me. So
So
after
the
10
important
years
thing.
of trying it was like, here we are. So, okay, I'm
Mhm.
done. I didn't mean to cry,
Yeah,
but
no. No, this is great. This is great. But we are going to end soon.
sorry, I'm
I
sorry.
know.
I'm
So
done.
I do.
I'm done.
No. Don't be sorry. We needed that moment because it's real. Sometimes we're looking at this from a textbook or a medical only perspective, and we have to realize that this affects real people. So we appreciate your candor. And like I said, I've been following your journey on social media. So thank you so much for that. What I wanted to do was turn to Ulrich and to whoever else can answer this, because Ulrich, what resources were out there for you as a male dealing with infertility? And maybe our two doctor experts can talk to that as well.
Doctor at that. So, we as professionals in the healthcare field, males get a certain reputation, but he had as much capacity to explain things as much as he could and walk me through it and be upfront about what the chances were. And I respected that. So it's like, hey, you want to get the surgery? There's about a 10% chance, blah, blah, blah. This one is invasive, this one's this, and sort of laid it out there. So there were options about medications, which I was able to do and explain the medications to me. Followed up with me, made sure that I would see him regularly. I would say a lot of the resources depends on the guy and the family to make sure that this is all happening, and making sure you're consistent about it. One last little joke, like I didn't start making my own doctor appointments until I was about 23. So that consistency of understanding, like, hey, I need to go to the doctor, or hey, it's next month, or hey, go get tested here, and not have anyone sort of chirp behind my ear and remind me or tell me to go ahead and do it, because this is important, especially in the healthcare portion of it, not to allow it to be something that I put on the back burner. So that's a stigma as a Black man, dealing with doctors that usually, if it doesn't hurt, I can't see it, throw dirt on it and deal with it some other day. But yeah, just making it a point of emphasis to fight. Some of those offices that I called, sometimes the phone would ring off the hook in terms of trying to make an appointment. Getting results, getting things faxed over to other doctors was a nightmare, and the follow-up sometimes. But in the end, it's seeing the end goal. It's not the destination, but making sure you're doing the pieces to make sure that you get there. So that's my piece.
Very important. Dr. Damarid, were you going to
Yes,
add to that?
yes, I'm gonna jump in real quick. So maybe you were listening to Nay share her story and you felt overwhelmed and you felt connected, right? It's important that you allow yourself to feel those feelings and let them come out. But it's also critical, to Nay's point, that you find community. One thing I can say about Facebook, baby, people can say a whole lot of stuff, but baby, when it comes to finding a community for somebody who's going through the same thing you're going through, that can be a resource. Therapyforblackgirls.com, plenty of women of color or providers of color that can provide you with all kinds of treatment or that specialize in infertility. Psychology Today. .com is another resource you can go and look for different providers to build your community. Don't do this alone. Don't go through this alone. in my profession, we have something called normalizing, right? Normalizing, in essence, is helping our clients understand that this is not a unique situation to them. Their experience is unique. We work with you, but overall, you're not alone. So find your community. Don't go through this alone. Find your group of gals that you can cry with and be okay, and know that this is a journey and you're going to get to wherever it is that you need to be eventually.
And if I can, Tachi, just add, first of all, therapy for Black girls, everybody should stick a pin in that one. But there's actually also a counterpart for that for young men. And I would advocate that all research and look into that. I also love ASRM, which is the American Society of Reproductive Medicine. They actually have a nice booklet that details everything from a patient perspective for men and for women. The American College of OBGYN, which is my college, and the CDC tend to take more of a female view because that's who we largely deal with, but ASRM deals with men as well as women, as well as Resolve, which is a national infertility association. One of the things that I love about doing these types of webinars, you have some phenomenal resources right here on this panel. So Black Girl IVF, FEW, filling empty wombs, your Dr. Demerit, who's here, as well as myself. We're not here just to be here. We're here as your resources who look like you. So I will put my email. I'm not a fertility specialist, but as a chief medical officer, I know a lot about a lot, and I know how to connect people. So I will, put my email, and feel free to email me because I think that, like Dr. Demerit is saying, the community is so important. I would also say stay connected to people. I definitely believe in prayer, but I believe in prayer with the action. So your action might just be to decide I'm not doing anything. That's still an action, but I do think that they go together. And so if you decide that you want to act, finding the right people to help you in those spaces is important. The last thing I will say to Jay is finding a physician, again, that is so important, or not just a physician, but a healthcare provider, but the urologist who take care of men, largely, and women, but those types of problems, I think it's important to connect with one of them who is compassionate, who has the knowledge and expertise, but can also provide you what you need on a cultural level. So I'm glad to hear that you found someone who does that. But I always tell people, if you walk into an office, like somebody said, there's a red flag, they're not addressing you properly, they're not looking you in the eye, they're not giving you the time of day, all those things that make your hairs tingle at the back. Take your stuff. Thank you so much. Be nice. Go and find someone else, because there are plenty of people who deserve your business and there are some who do not. But in this space, especially since there's so many stigmas and barriers that we've already identified, it's critically important to find someone and find them as quickly and efficiently as possible. And by the way, one other thing, Tachi, somebody mentioned about money. There are definitely resources to help people. I did want to mention that, especially options in the IVF space. There are different levels of IVF. So those are, again, some conversations that maybe Nay mentioned it, that you should have with your physician about options. There are different levels of IVF and assisted reproductive technologies. I mentioned some of those early. Could be as simple as some medication, which is a lot cheaper than going some of the other routes, but finding out what the cause is probably the most important. And many of those things are covered and should be covered under your healthcare plan. And if they're not, don't just take the doctor, the office's word for it. Please call your healthcare provider, your plan directly, and find out from them if you don't have a listing, because sometimes people, that's their easy out for some, not everybody, to say, oh, it's not covered. Well, in fact, it actually is. And there have been changes in legislation where some of these things actually are covered. So do your homework, act on your own behalf. You actually are one of your best resources, not your only one, but one of your best resources. So please remember to advocate for yourself.
That's a word right there. You are one of your best resources. Excellent, excellent. Okay, so I'm going to throw myself on the mercy of the committee. Because I had a camera issue, can we extend just 5 more minutes? I'm throwing myself on your mercy because I think this is too important to just cut it off. I just need 5, please. And even if you tell me no, I'm going anyway. So we're
Keep it
going
going.
to keep going. Okay, thank you. We're going to keep going. Okay, just 5 more minutes because I did have that camera issue
gotta have a
at
part
the
two.
beginning.
Gotta have a
Yeah.
part two.
Yeah, I mean, I'm sitting here. I'm like, there needs to be a part 2. This could be several parts, not even just a part 2. This could be like a 4-part series on Netflix. I'm telling you. And the interesting thing is, I don't know if you all saw, but PBS just had an issue on Black women and maternal health. It just, if you look it up on PBS, it just happened like last week. So this is something that is a topic that is in the news, from fertility or infertility all the way through delivery. So Black maternal health is, I hate to say it like this, but a hot topic. So if you are looking for some more on that, check out the special that was done on PBS last week. I do want to say, please, 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 if you are attending, make sure that you click the link in the chat for the survey. We want to know what you think about this program, and that helps us to plan for other programs for important topics like this, or hopefully this again, because we do definitely need more of these. Definitely a part 2. And we have some comments. Somebody say they really appreciated this conversation. Somebody saying, Nay, thank you for your testimony. Somebody is also saying awesome job to the panelists. And we do have a question from the audience, and that's why I wanted to take this extra 5. For the panel, how would you approach a case who is at poverty level and challenged at other ends of social determinants of health, meaning race and age, that don't have access to care but want to become pregnant? And thank you for asking this, because I was thinking about the class issue thing. Whoever wants to start, please go.
I'll start. I think, and thank you for that question, and whoever was brave enough to put that in the chat. Right now, there's an entire campaign related to social determinants of health from so many medical resources, medical colleges, and organizations, that it is important for you to have that conversation with your physician. So I'll speak for our healthcare system. We just had a diversity, equity, inclusion talk yesterday, which was social determinants of maternal health, which we've said is like this hot topic, but we've now built into our system where it is mandatory for everyone who comes to our facility to be asked and have answered questions that relate to the social determinants of health for whatever it is that you're coming in to see us for, whether it's in the emergency room, one of our primary care clinics, and then in our Memorial Primary Care clinic, which by the way, I go to. I have insurance, but I get the best care there because it's holistic care. It's a medical home model. And what a medical home model does is, you heard the word holistic before. It takes care of my medical, physical needs, but they ask me about my mental needs, my emotional health, all the things. Do I have enough money? Do I have connectivity? If I can't get there, can I connect through my phone and do telehealth? And do I have the cell phone towers and a whole host of things like that? So I'm going to encourage you to find a healthcare provider that provides the medical home model, because they also provide social workers, social work services, and community services that may be available to help you address some of the social determinants that you are concerned about, that can then help you to get the other areas taken care of. Because one of the things we also know is, if you're challenged by, do I have enough food to eat, and do I have enough money, and things like that, maybe you are challenged by eating healthier, because that is important for becoming pregnant when you want to become pregnant. Maybe you're challenged by being in a safe enough space to have a place to exercise. Nay gets to go to exercise every day. Not everybody has that luxury. You want to walk around your community and get some exercise. It might not be safe. So those are some of the things that persons who work in a medical home type of a setting can help to address. And then when they're addressing those, these other things can come into play, in terms of, you may find some of the resources like Black Girl IVF that can provide you with financial resources, or others that have been mentioned. But you always want to make sure you're taking care of your basic health needs. And I think that that's a great place to start.
Did anyone else want to address it? This is going to be our final question. So if anyone else wanted to address that, I would love to entertain that.
Yes, I wanted to address a little bit. Right now, Resolve, I'm part of the Resolve. I love Resolve and ASRM, and we're actually having an advocacy day. Like we're challenging lawmakers to change policies to give access to care and all around. So in each state, every year, Resolve go and talk to lawmakers. This will be my second year just to be able to change policies. Because that's another reason why we need to have conversations like this, because we need to hit it where it matters. And that's, unfortunately, that's our governmental system, to help those policies that pertain to our needs and what our needs are. So addressing those things, and Resolve is still looking for some states that don't have any representative. I'm in Florida, and we here in Florida will be representing for the state of Florida for access to care with Resolve, as well as we are meeting with about 6 of our government officials to be able to help in that Resolve. And also, we do have foundations that also help. I share them all the time when they pop up, because I follow the other infertility and IVF places like the Cade Foundation. The Cade Foundation offer IVF up to $10,000 about 3 times a year, and about once or twice a year they give full care, and that's IVF or any fertility care, adoption, or surrogacy that go towards your care. There's fertility of color, and there's actually fertility of color also have a men's segment as well. That's for the women as well as men. There's a one, I'm not sure if that's the clinic you were talking about in New York, NYC. They give you about $4,000. They charge under $5,000 to do your full IVF treatment. Under $5,000, and they just opened one here in South Florida.
Yes.
So I actually have a live with him in a couple of months. So there are things there, but you have to be willing to do the search. And there's people like me, as well as Black Girl IVF, that we putting our information out there because we don't want this to be a repetitive conversation for our children. Like, the stigma should not stay around when our kids are of this age. So unfortunately, I wish our elders had those conversations, but they didn't, because this would not have been a repeated segment. We would not be having this conversation now. And we are at 2023 and we still having this conversation. And we need you, whenever you're ready, whenever you're willing to share, only when you're ready to share. I'm a strong believer of the cross and the couch. It goes hand in hand. You go to Jesus, you go to your therapist. And it has been a big change for my own infertility journey. And I've helped others to understand that when you speak, it's therapy for you. Regardless, you just have to find who to speak to. If that's a therapist, if that's a judgmental friend, you need to be able to have that space to really let loose. So, but what I mean judgmental, I mean, you don't need the friend that's going to attack you and just say, pray about it. Because if you tell me pray about it as a Christian, I'm going to need you to tell me how many times I'm supposed to pray, because I need numbers. But that doesn't just fix the issue. We need that community to have those conversations, look for resources. So as we chatting, go to these organizations that literally will pay you to have your treatment done for you. And they do this every year. Last year there's a part that didn't have anybody that applied. And that's funding that we're missing that they're willing to give to you. So please use those resources. Feel free to contact me and I will share those resources for you, but they are around and they are available. And the Cade Foundation is Dr. Hammond. She's a woman of color and she's a physician. She's a woman that looks just like you that went through infertility treatment as well.
Sandra, thank you so much for all that information. Thank you to all the panelists for the—
Sorry, Chuck. Can I add one little thing? I'm sorry.
Yeah, go ahead.
Just to kind of piggyback on Sandra, when we're looking at places that get help with funding, ironically enough, you'd be surprised how many companies actually pay for IVF that you work for. Company like Starbucks. I know it sounds weird, but like Starbucks pays for IVF treatment. They also cover adoption and different things like that. And again, not all of these jobs are always easy to get, but I'm just saying there are businesses that you can work for part-time or full-time that pay for IVF. American Express. I mean, there's like a list of companies that will also cover the price. And then, like Sandra said, CNY Fertility up in New York. I didn't know they opened up something down here with Dr. Katz. He does, if you go onto his website, his Instagram, you can just look up CNY Fertility. He's on there all the time. They sometimes give away, treatments, and he's very, his whole concept is to make IVF, whatever that looks like, whether it's IUI, IVF, whatever it is, he tries to make it as affordable. It's kind of like you get to pick what works for you, and he still does a full workup on you. And the things that he starts with 9 times out of 10, it can be covered by insurance. But there is a lot of resources. You just have to kind of dig around. But again, the whole panel here can probably push you in the right direction to find the funding that you need, or something that can at least help you. And as a person who worked for a company that when I first went into my IVF doctor, they didn't cover it, but the day I go in with my check and they ran my insurance again, I found out it did. So, and then also, here's another thing, keep in mind drugs, a lot of shots, it happens. I will eventually share with on my Instagram page, my videos of me doing my shots. Sometimes the shots aren't covered, but when they are, they are. And then don't take one pharmacy's word. I actually had to go from one pharmacy to another pharmacy, and one of my pills was $2 a pill. I ended up cutting that in half by just finding another pharmacy. So, just kind of use your resources and really dig around, because you'll find some ways to make it affordable. But again, here's a whole resource in this whole panel, and we're happy to.
Thank you so much for that, Nay. And I know that some of you have already started putting resources in the chat. So I know it's a lot in the chat, but I know some people had put it in the chat already. I'm not sure if physical and mental health, if there's something that you're going to be able to do to aggregate the resources that have been put in the chat, but you can let everyone know if that is the case, because somebody did mention we need those resources, and there was a lot of good information that was shared here tonight. Okay, I do see another hand. Oh, Rick, you have your hand up. Go
Yes.
ahead.
Real quick, another thing that I appreciated about my doctor was his diagnosing. He knew what I was in there for, but my insurance didn't cover those direct things. It was going to be a lot of out of pocket. So he found a roundabout way of getting me some of my medications that my insurance would cover for another reason. So it's not quote unquote ethical or whatever, but hey, sometimes we got to play dirty to get what we need.
Wow. Thank you. Thank you very much for that. Thank you so much. And so, all right. So we are unfortunately going to have to cut off because we are over, but that's okay. I think this was a good over. I think we needed this information, and there is much more to learn. So hopefully we will get a part 2 and 3 and 4 of this conversation. So with that, and there's a lot of great stuff that's being put in the chat as well. So with Tramika Wade said the extra 15 was worth it. The panelists are very passionate and resourceful. Love the knowledge. Thank you. I agree. I absolutely agree. All right. So if we what we're going to do is actually have a summation or closing remarks from, I'm not sure if it's our committee chair that is doing that, or is it you, Sora Neely, that is giving the closing remarks?
Sora Gauze, it should be available and be on to give closing remarks.
Great. She is here. Sora Gauze, the floor is yours.
Evening. Yes, good evening, everyone. Good evening. Such a spirited conversation tonight. So thank you. We do realize that obviously, since we have not finished our conversation yet, that this is a much needed topic that we need to look into further. I am Sharice Gauze. I'm the chair of the Physical and Mental Health. And so on behalf of the committee, I just want to thank Assistant Chair Delphine Gervis for just the vision and the actual execution of this webinar, along with her subcommittee. You all did a phenomenal job. And I want to thank our esteemed panelists for just taking the time to provide so much insight and wisdom with our listeners today. This is obviously a much needed conversation. And I also just want to say thank you for the transparency. Thank you for giving information and certain little hacks and nuggets that you have to make it easier for the next person's journey. And I also just want to thank our IT team for pulling this together for us. Thank you to you, Sarah Tachi, for hosting for us. This has been phenomenal, and I look forward to continuing this conversation.
Fantastic. And with that, we thank you all for coming. We look forward to seeing you again. Oh, do we have any of the upcoming events that you need? Yes, here we are. So as you can see on the screen, we have some upcoming events. The Ella Fest, which is Education, Literacy, Letters, and Arts. That's happening Saturday, May 6th from 10 a.m. to 2 p.m. at Hallandale Beach High School. And you can see the address there, but you do need to register. You can register in advance at bit.ly/EllaFest. Red Hot Day Party. We all like a red hot day party. Amsterdam, which is going to happen in Hallandale, 100 South Federal Highway, Hallandale, Florida. And it is a 21+ event that is happening in June 4th from 2 p.m. to 6 p.m. We all love a good day party, right? Then you could go home and sleep and not worry. So take a look at that. Also, Self-Care for Black Women, a mental health and wellness seminar will be happening Monday, May 1st from 7 p.m. to 8:30 p.m. And it is another Zoom webinar. We have Carla Powell and Erica Collins who will be running that. So look out for that as well. And for more information, you can contact sbac.education@gmail.com. Delta's on the run. Speaking of health, we're looking at physical health here. And that is our 5K run walk. And that will be happening Saturday, April 29th. So just in about 10 days or so, the first 200 registered participants are guaranteed a finisher medal and race t-shirt. And you can see the information below. You can register at dstsouthbroward.org. I believe that is it for our upcoming events. And of course, you can go to the website, dstsouthbroward.org, to register for these events and to find out more about the events. And with that, I want to say one more time, please, before we go, make sure you click the link in the chat. Maybe we could put it up one more time so that we could get you to fill out the survey about this event. We appreciate you being here. We would appreciate it also if you would fill out the post-event survey. Again, go to dstsouthbroward.org to find out about our upcoming events and more about what we do. And with that, that's it. Thank you so much for being here. My name is Dr. Tachi or Chitachi Egwu, and I wish you a good evening. Cheers.